Hello again. I'm here to tell you just a little bit more about my story, my personal story in terms of my career and how I made a big change in my direction. I have a 5-year degree in nursing and many decades in intensive care, as I've mentioned before. I've always taken hundreds of hours of additional coursework and stuff during my career. I worked directly in a burn center right out of college. And then from there, I worked in trauma center up in Detroit at Henry Ford Hospital. I was then recruited down to Wichita to open up a regional burn center down here. And I've never left. I love Wichita. Anyway, over years, I made the change and decided to work in medical intensive care. And that's where I started to make a real switch. I began really noticing and asking, where are all of those things coming from? That in medical intensive care is where you see all of the intensive cares of infection and end-stage renal or kidney disease, lung disease, heart disease, all of those kinds of things, diabetic situations. And those are usually coming out of a chronic situation. So I kept asking, well, where is this coming from? And being somebody who always reads a lot, I kept reading, the usual journals and such, and I kept finding the idea of this or that or the other thing being idiopathic, which is just a fancy word for saying we don't know where this is coming from. So I decided to broaden my scope of what I was studying, because I guess I'm still like the 2-year-old and it's still, why, where is this happening? Why is this going on? So I expanded my research and my reading and study into other university research that was not directly medical, but looking at environmental toxins and situations that have an effect on the human body. And that's where I started to really come up with the ideas of where things might be coming from in terms of the healthcare situations of so many people. At least it was a smoking gun was there. In the meantime, I kept wondering, where is this, not just where it's coming from, but why aren't people getting well? We're doing so many things. They're on so many medications and procedures and things that are being done, but they're not getting well. They were on myriads of medications, but they were not getting well. It was handling certain situations, but they were not continuing to get well. At this time, I had become much more aware of the environmental issues and the problems with our food sources, chemicals in our foods, the lack of nutrients in many of our foods because of our farming situation, and so the diets that we're all on in terms of standard American diet with all the sugars and all of those kinds of problems. But that's when it hit. Like most people, I didn't make changes in my lifestyle and in diets and such that maybe should have happened earlier. But my husband turned up with a lymphoma. And so that's when I jumped into action and literally cleaned everything out of the house that was at all toxic. All chemicals came out. Everything we ate was organic, and really, really started focusing on those kinds of issues. Now, we went to both an oncologist and to an integrative medicine physician. The integrative medicine physician found that my husband had a lot of heavy metals on board. Yes, they were exposures from his work environment, and we started working on getting rid of those, and we'd done enough work that he never needed to go on to the heavy chemos and stuff that the oncologist was thinking he was going to need. Things simply started to resolve, but it took a lot of work. It's been 16 years now, and he's doing extremely well. There's been no further signs of any problems at all. So over those course of those years, I really transitioned my many hours of study have then now turned into thousands of hours of biochemistry, of nutrition, diet, various testing techniques and such in order to help others and to expand our understanding of our health care and to help people to be well. So there you have my story.